Good morning. Thank you for joining us for our December presentation in the fifth year of our speaker series, Toxicology in Societies, the Impacts of Chemicals in Our Lives. I'm Ian Moran, a visiting assistant professor of environmental toxicology at Western Washington University. I'm joined by my co-hosts, Ruth Sofield and Tracy Collier. Hello, Ruth. Hi, Tracy.
Folks.
Hello, Tracy. Or Ian.
Ian.
We would like to begin by acknowledging that we at Western Washington University are on the ancestral homelands of the Coast Salish people who have lived in the Salish Sea Basin throughout the San Juan Islands and the North Cascades watershed from time immemorial. Please join us in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation and Nooksack tribe, for their enduring care and protection of our shared lands and waterways. And now I'd like to go over a few logistics. We will save questions for the end of the presentation, but you can use the Q&A feature on your screen at any time. You will be muted throughout the presentation, so we will use this feature to interact. The focus of our speaker series is to provide understandable examples of how events with a toxicological component have consequences to people in society. Today, we are delighted to welcome Casey Buell. Casey is a professor of practice at Oregon State University and serves as the deputy director of the Pesticide Educational Resource Collaborative. Today, she will be presenting on safety and health communication related to pesticide risks. Welcome, Casey.
Thank you, Ian. It's a pleasure to be here. Thank you for the invitation.
Fantastic. Well, if you want to share your screen and get started, the floor is yours.
All right. I do have a lot of content to go over, so I'm going to go kind of fast, but this is recorded. You can always come back and slow it down later if you like. Let's do that. So thank you for the opportunity to be here. This is a topic I am passionate about, and I'm going to draw upon my experience at working with the National Pesticide Information Center. Dr. Moran was a graduate student in my department. I feel like it was recent. You'll probably tell me it was 5 years ago or something like that, but it's great to see you out in the world doing great work, Ian. Thank you for the invitation. All right, let's just jump in. I'll start by telling you just briefly about myself. I'm a professor of practice in the Department of Environmental and Molecular Toxicology, but the students I teach are not OSU students. They are pesticide applicators, both licensed and unlicensed, all over the state of Oregon. So that's kind of what that means, professor of practice. I teach practitioners. So often I'm talking about pesticide safety practices, formulations, selection criteria, personal protective equipment. But I have learned quite a bit over time about communicating risk. And really, that's because when I first came to OSU, and that was been more than 20 years ago now, I came to work at the National Pesticide Information Center. This is what brought me to OSU. It still exists here at OSU. It's the only national center of its kind. It's funded through a cooperative agreement with the US EPA, so we competitively compete for this cooperative agreement every 5 years or so. And we're pretty proud that it's been at OSU for over 30 years at this time. This means that we're answering questions from around the country about pesticides, about risk, mostly from consumers. About 15% of the inquiries do come from professionals, but that includes things like veterinarians, health clinicians, public health people, regulators, inspectors of pesticide issues. But the bread and butter, the meat of our calls, all come from consumers, moms and dads, families, renters, people that have questions about pesticides in their own environments. And I should say a word about this at the outset because often the word pesticide is kind of confusing because it's an umbrella term and it includes a lot of different kinds of pesticides, including insecticides, fungicides, rodenticides, herbicides, including that is another word for weed killers. Even antimicrobials are considered pesticides under the law. Just a little bit of background about how this experience at the National Pesticide Information Center taught me. We take thousands and thousands of inquiries from all over the United States. We learn what people are asking. We learn what kind of information is compelling to that person. For example, someone might call and say, "Can I use this pesticide on my tomatoes?" And we might say, "Actually, no, it's not labeled for that." Well, why can't I use it? Well, it's illegal. Maybe that's not really compelling for the individual who doesn't think the cops are going to come to the garden. So instead, we might have to use different arguments like it hasn't been evaluated for that area of risk. So in that vein, we're finding out what people find interesting, what they find compelling about these arguments, and then we communicate that We take all that learning and actually put it into our website. So I hope you do make use of the NPIC website over time. You'll notice in the upper right corner, there's an A to Z index. And that's a great place to browse our website and see what kind of stuff we have. We have pages on pesticide devices. We have pages on antimicrobials and disinfectant wipes, fungicides, risks for dogs, but also fact sheets on a number of different active ingredients that might be relevant to projects going on in your state. There's quite a few state regulators in Washington and in other states who use our fact sheets when there's an incident or a newsworthy event about a chemical. It's nice to have a fact sheet about it, and we try to make those, of course. Just to underline that it is a national center, we take inquiries from around the nation, and they roughly approximate the population, except in Oregon, we get more calls from than we should based on Oregon's population, but that's just because we're located here. It is a science-based information service. We answer phones on Monday through Friday. And just last month, we started doing live chat because it turns out the kids don't like making phone calls anymore. And when I say the kids, I mean anyone under 30. They don't like making phone calls. So the number of phone calls that we took was going down and down. Now we're picking that back up by going through live chat, which is a technology that's much more native to young people in the United States. What kind of things can you call the center for? We don't make recommendations, product recommendations, but we can help people compare the toxicity of products, evaluate persistence. People who are very sensitive to chemical exposures, they might call themselves chemically sensitive, care a lot about the half-life and the factors that affect the half-life. So that's a topic we talk about a lot. We discuss specific pesticides, their potential health effects. I'll let you read the rest of those, but that gives you a sense of the kind of services that we have been providing and kind of how I came up in my risk communication training. One of the things we've learned over time too is that fact sheets are not as fashionable as they used to be. An infographic is actually much more powerful. It's shorter and it's also meaningful because when you pair information, especially complex information, with a scientific emphasis, it's already non-native for people who are not used to thinking and talking about scientific terms. If you pair that information with a meaningful image, it is much more memorable. So infographics are sort of the new wave of the way we're communicating with folks, and they're easier to translate into English and Spanish and still make them very shareable on social media. It matters if they're shareable on social media because we should be in the places where these conversations are happening rather than just putting all our communications on our websites and expecting people to come get it. We need to put the information in the path of information who is seeking it. And that's going to be on social media and a number of different platforms. How do people find our phone number? About a third of people find the center because our number is published on product labels. About a third of us people find us on the internet just by Googling. They might be looking for a chemical or a pesticide name. And there's a couple other ways that people are finding us, and you'll find our phone number all over the internet. But we've built that all into a suite of information that's intended to try to meet people where they are. When we write for the general public, we try to write at an 8th grade reading level. And if you didn't know this, there is a way in Microsoft Word to measure the reading level, the readability statistics of your own writing. And we just use those simple tools that are already built into Word to try to get that reading level down to an 8th grade level. And there's 2 quick tricks about that: shorter sentences and shorter words. You can say the same things. You just have to say it differently to make it more accessible to a wider range of the US populace. We're also putting that information out in webinars, social media, comics. You get the idea. We stopped doing podcasts because it wasn't very popular, but we're ramping up in live chat in other ways. You have to be nimble as communicators in an ever-changing landscape. That's all I'm going to go into about the National Pesticide Information Center, but I wanted to give you a sense of where I'm coming from because I'm going to give you a lot of examples of like calls I've taken, trends I've seen, and things like that. I came to the center after having an education at Michigan State in integrated pest management. So I studied weeds, insects, rodents. I studied economic thresholds and how to do the ecology analysis of pest management. But after I started working at the center for about a year or two, I started to realize this was a piece of my training that was missing. I was confused when I would give the same information to different callers and they responded to it completely differently. So I hit the books. I started doing some studying and a whole lot of reading about psychology so that I could fill in the gaps. And what I'm finding out, this was a special issue of Environmental Health Perspectives. The whole issue was about risk perception, and it is just emblematic of how important the issue is. But one thing to say at the outset is that most risk perception is determined by fast, intuitive feelings. One of the books that really helped me understand this is Blink by Malcolm Gladwell, who talked about how our lizard brains essentially protect us by making very quick decisions about things and whether or not they're risky, whether or not they're safe. And often it might be perceived internally as a binomial. Either this thing that I'm evaluating is safe or unsafe, flipping a switch back and forth. And those quick decision-making skills have helped protect humans for many millennia. So it's not necessarily wrong, but it makes it very difficult to change those perceptions or to influence them. We do have to understand risk perception in order to be good communicators. I'll make that case. Another thing to start out by saying is that risk does not exist out there independent of our minds and cultures waiting to be measured. Um, I've definitely spoken to toxicologists who disagreed with me on that point. They'd say risk is measurable and it is something that we can quantify and compare. But I would argue they're talking about the probability of harm. And risk is a bigger concept in our brains than that. We made up the concept of risk to help us understand the uncertainties of life, and many communities perceive risks differently. There's a lot of great literature on this about how you can even break people out into different buckets by race, by gender, by nationality, by occupation, and they perceive risks differently. Trauma can also inform risk perception, those internal calculations. I also want to start by talking about the word risk and how the perception may be different between the professionals I anticipate being part of this webinar. I anticipate this webinar is full of trainees and people who are trained in toxicology and potentially how we characterize risk. But when we do that as professionals, we're thinking of the probability of harm, and that classic S-shaped dose response curve comes to mind. That is measurable, certainly, but it does not encapsulate everything we think of in terms of risk, even in our own internal calculations. When people who don't have this training and background and deep level of thinking about risk, and they hear the word risk, they might be thinking of the word danger as a synonym, that it's the same thing. Risk means danger, and it's either a yes or no thing. It's not at the population level. Professionals tend to think of risk at the population level. It's the percent of the population impacted. But I promise when a mom calls you about the risk to her baby from using a pesticide in the baby's room, she's very concerned about the spiders that she's finding in the room. She doesn't want the spiders to bite the baby, but she also doesn't want the pesticides to hurt the baby. She is not concerned about population level risks. She's concerned about herself and her child. And it's much more personal and it's much more binomial. So can you see why there might be a disconnect when a member of the general public would ask a toxicologist, is it safe? And they respond with some kind of population level stuff. It's like we're answering a question they didn't ask. So there might be some ways that we can approach that with language. And here's my first approach. My suggestion is to avoid the word safe and instead talk about risk. If you answer that something is safe, it's a yes or no answer. It's binomial. If something is safe, no precautions are necessary. And safe is safe for everyone. It's easy to explain. I can give you an example. I took a call from an individual once who said the pest control company, the technician was just at my house and he made an application and he said it was totally safe, but I know he was lying because he was wearing gloves. If it's safe, no precautions are necessary. That's why that whole concept of safety is probably oversimplified and inaccurate, and we should just let it go. Based on the literature, we understand that things are either more risky or less risky, and precautions can reduce that risk. And we also know that risk is higher for certain people. The risk of pesticide exposure, for example, is higher for pregnant women, infants, children, and also at the other end of life for elderly individuals, the risk goes back up again because things are going on with their metabolism, the thickness of their skin, the ability to detoxify toxins is changing as older people get older. So we know that risk is higher for certain people, but it is certainly harder to explain. But I'm going to make the case that you should try and you should work on it. Stop using the word safe to the extent possible and instead use the word risk. Because when you do give someone the impression of safety, that can lead to careless behaviors and a lack of vigilance, and therefore increased risk. One example is often I talk to gardeners who use only organic products. You can use pesticides in organic gardening. You just have to use the organic ones that are natural in origin. But it gives people this sensation that those things are risk-free. And there have been some pretty gnarly incidents with people being exposed or their pets being exposed, their kids getting into those products because they're not treated with the same care. Another example I can share with you, I took a call from someone who bought the dog safe brand of slug bait. In the Northwest, we often have to use slug bait if we want to grow lettuce in your garden or kale because the slugs are so bad. But there's one kind that really hurts dogs, and there's another kind that doesn't. So she picked the one that was dog safe. So she didn't have any concerns at all when she saw the dog was eating the whole bag of slug bait. It's okay. I got him the dog safe kind. Well, it might be safe to use around dogs, but it never said it was safe to have the dog eat the whole bag. You see how this happens? That's how I make the case. The word safe is unsafe. The product label said dog safe, but it meant safe to use as directed around dogs, not open it up and treat it like dog food. You said it was safe and you filled your swimming pool with it. You get the idea. So how do we change that? You can reframe the safe question if someone asks, is it safe? One way to respond would be say the risk is low, but tell me about your specific concerns. You're giving them some information first, but then you step back to listen. And the importance of listening cannot be overstated. Sometimes that question comes from a very specific place, like my kid has asthma, or my grandma with cancer is in the back room, and we've been told to keep her exposures low because her immune system is compromised, or something that might be very relevant information to share if you stop and listen. Then you can quickly explain why safe isn't the right word or mindset. I don't want to tell you it's safe because it is a pesticide and it's intended to kill things. If it was a safe pesticide, it would be a useless pesticide, right? Because it has to kill things in order to be effective. So maybe that's an easy case to make for pesticides because they're designed to kill things. But even if you're working around PFAS or polycyclic aromatic hydrocarbons or something like that, you might still be able to say, well, they're not necessarily safe because the dose makes the poison. But let's talk about the risk level and things that affect it. I'm going to go into some detail on the listening side and show you some of the elements that have been incorporated into the training program at the National Pesticide Information Center. And one of them is this concept of leaping. Listen, empathize, apologize, and problem solve. You can imagine we get lots of calls from people who are angry about pesticides being pesticide exposure that they didn't choose and don't consent to, and maybe they really want to do something about it. So the approach is to listen first and ask scoping questions that get them talking so they can get it all out. Sometimes the difference between making a call to the governor's office or a call to the media and not doing that is just the sensation that someone heard you and listened to your entire concern. Um, and then empathizing might be statements like, it sounds like this has been really difficult for you. I'm so sorry that this is the case. It sounds like you've been on a real runaround talking to a lot of different agencies. You're empathizing, you're kind of rephrasing back to them that they've been through a lot. They're facing big things and they want to know that you get it. The apologize part is not apologizing for the exposure or anything that was outside of your control, but much like the example I just gave, you might say, I'm sorry, this is so hard. I'm sorry, it's hard to find good information. I hope I can help you today to give you the information that you're looking for. I'm sorry that happened without your foreknowledge. Is there anything that you can do to ask for that notification in the future? So you're putting in an I'm sorry or a expression of regret without taking responsibility necessarily. If you didn't do the thing, you don't have to be responsible for the thing. But only then, after they've been heard, they've been understood, then you can move into problem solving. I just got distracted because I noticed that my video is frozen. Well, maybe it's only frozen for me.
I
I'll
can
just
hear
keep
you loud and clear. I see your video frozen, but I can hear you just fine.
Okay. I might turn it off and on again, see if that helps.
Sure.
All right. And when we say to leap over the barriers, there are some clear communication barriers that have been described in the literature, and I've listed some of those here on this slide. It can be a barrier to good communication if people notice a difference in values. So for example, I was taking a phone call at NPIC once and I heard someone hit their dog. They were telling him to shut up and they made a noise and the dog yelped. And I was like, that violates my values. I would never hit my dog. I can't believe you just did that. And it made it very difficult in my head, even though I'm maintaining professionalism. I had a very hard time communicating with that individual after there was a difference in values identified. But that's one of the barriers. So I had to come back and leap over the barrier, come back to listening, empathizing, and focusing on the individual's question. Um, Experiences can be a barrier to communication because somebody might tell you about an experience and immediately your brain goes to thinking about a similar experience that you had. All of a sudden, you're not listening. There can be personality differences and roles. I really want to mention roles for this audience because I think I'm speaking to toxicologists and future toxicologists. That being the case, your role as a toxicologist will get in the way of people hearing you. It's just like your role as a cop or your role as a clergyman might also get in the way of people hearing you because they have ideas about that role. And they might be making assumptions that are or are not accurate. So notice when there's a breakdown in communication, when there's not a good back and forth, and try to come back to that leap strategy to get over the barriers. I know it's a cliche, but I found it to be true. People don't really care what you know until they know that you care. They're not going to hear the information, the great science you're communicating until they know that you care. I'm sorry. I know it's touchy-feely, and we often go into science because we don't like touchy-feely stuff, but here we are. This is some coaching that's often used in marriage counseling, family counseling, other things, but it is certainly something we can learn from. So I'm just going to spend 2 slides talking about active listening. It shows empathy and it builds trust. So an example of how to communicate empathy might be the feel, felt, found approach. You acknowledge their feelings. You share how you felt similarly about it at some point until you found and you share some information that changed your mind. So you can see in the beginning, the first one is I acknowledge your feelings, they feel heard. The second one says, I'm like you. I thought something similar until I learned a certain thing. It's also saying, I don't think you're dumb because you don't know this. Because very often, I think scientists in particular can give information that's very well-meaning and intended to be helpful, but people can feel insulted by it. Like, are you calling me dumb because I didn't know that? So say up front, I understand as a toxicologist that everyone doesn't know this because I didn't know it always. And then I learned this, and that. So feel, felt, found can be a helpful approach. But also some tips on active listening. Ask open-ended questions like, tell me more about that, or tell me from the beginning, instead of asking yes or no questions, because that can feel really like an interrogation. Give them minimal encouragements. That's things like, oh, really? Okay. I got that. What's next? You're giving them verbal confirmation that you're listening. Effective pauses can get people to share more information. Paraphrasing information back to them makes them feel heard. One of the training pieces that we use at NPIC quite often is to paraphrase the person's questions back. Say, so I'm okay, now that you've told me your story, I understand that you're seeking this, this, and this. Is there anything else? That also shows them that I'm willing and patient to answer your 3 questions, and I would be willing to answer a 4th. Is there anything else? Paraphrase the question back to them and give them permission to add to it. Refrain from responding until the problem statement is really clear. That's one of the hardest things to train our new specialists because they're so smart. We hire people with master's degrees and a passion for public service. And they're very quick. You can ask a question like, is it safe to use this around my kid? And they launch into everything they know. We really shouldn't be launching into a response until we have the problem statement clear. What's prompting your question today? Is anyone sick? Do you know what product? There's a whole lot of information exchange to happen before you move into problem solving. Refrain from problem solving too quickly because it makes people feel unheard. So to emphasize that, listen, empathize, apologize, and problem solve. That leaps over the barriers. And this is something to practice like yoga. Like it's a practice that I'm still working on 20 years later. And I often have to remind myself, here's a barrier. Get your head back in the game. Make sure that you're focusing and you're able to hear this person's true concerns. Now, when you get into communicating about the risk itself, you'll probably recognize the risk equation at the top of the slide, which came from my classic education. So when someone asks about risk or safety, and I reframe it as risk, I'm always going to respond by answering things in the toxicity side of the equation and in the exposure side. So the bullets you see listed are things we might discuss to answer their question. If they're asking about the safety of a pesticide, I might talk about the toxicology of the active ingredient, the product signal word. We have signal words that communicate in general how toxic things are on a pesticide product, maybe a dose estimate. Maybe they're concerned about specific symptoms like a plane was flying overhead and now I have a headache. What are the signs and symptoms of exposure to the pesticide in question? But I'll tell you, very often these risk conversations spend more time on the exposure side of the equation than on the toxicity side, because there's actually things you can do about the exposure side. You can talk about distance to the application site, routes of potential exposure, the relevant phys-chem properties. For example, if they're worried about inhaling a product, then let's look and see if it's volatile. If it's going to be something that volatilizes after application and presents a longer-term inhalation risk. The duration or frequency of exposure, sometimes it's helpful to let them know it's not bioavailable. If you get it on your skin, it's not absorbed well through the skin. Those are the kind of things I'm talking about, assessing exposure and discussing it. I want to come back to signal word just for a moment. For those of you who don't know, pesticide products have a signal word on the label. In this example, the signal word is caution, and you can see it's always a little bit bigger text in bold and all caps. So you can look for it. Caution means low toxicity, warning means moderate, danger means high, and that describes its acute toxicity only as bottled. So if that bottle requires you to dilute the product before you apply it, it will get even less toxic because of that dilution. But the signal word can be a great way to assess the toxicity of a product really quickly. So if someone asks over the phone, I'm looking for a low toxicity product to use in my daycare center, we'll tell them about signal words and encourage them to go see what's available and recommended at their local stores or wherever they shop. And they can use the signal word to compare across things. But only acute risks are calculated into the signal word. When things get a little more complicated, this is something we call the tox box, and we include this on our fact sheets for all of our pesticide fact sheets at the center. And it gives us, this happens to be the tox box for glyphosate. So you can see it's the yellow boxes are indicating where the literature kind of put the doses. We did a literature search that included the EPA documentation for its registration, but also went to the broader literature to see what other studies had been done. So this enables our specialists to look at the tox box really quickly and start communicating. We might be able to say the product is low or very low in toxicity by the oral route of exposure, by the dermal route of exposure, by inhalation, and it also covers primary eye and skin irritation. These are the routes that are considered in the signal word. But this table is based on the active ingredient alone at the highest concentration possible for testing. So it can give you a sense of that as well. We have technical fact sheets that look like this. They're intended for professionals, but we also have general fact sheets at the 8th grade reading level that are intended for consumers. I hope you like our technical fact sheets. You should totally check them out. Okay, moving on. Even coming into the job fully understanding the risk equation, there was more. There's more to this. And the more we discussed it, read into it, we've actually incorporated concepts of benefit into our training because there's no acceptable risk in the absence of benefit. There were certain callers I could talk to and just describe the risk being vanishingly low, but that wasn't good enough. And I came to understand it might not be about the risk. It might not be about the toxicology. It might be this problem because all risks are understood, are evaluated in our brains, contrasted to a benefit. So for some of the people I spoke to at the center who were the most upset about pesticides, they really didn't see any benefit of that application. They wanted it to stop. Here's some science to back that up. There's a researcher here in Oregon, at the University of Oregon, actually, named Dr. Paul Slovic, who did this research in psychology. He asked people to rank the benefits and risks of exposure to radiation in two different ways, two different treatment groups. People who were asked about the nuclear power, it was described as having a low level of radiation from living in a community with a reactor, and it would be about the same level of radiation that you experience from the sun. And for the people who with X-rays, it was described as a high dose of radiation that would be delivered all at once. I think this is interesting. As toxicologists, you probably know the risk of harm, the probability of harm is higher for X-rays. But they ranked the benefit high and the risk low. The benefit of X-rays is that you need the information in order to determine if you broke a bone or have some other health condition. So the benefit was high and the risk was low. He also went forward to ask the next question about exposure to chemicals. Exposure to chemicals. With the pesticide question, he said it would be low levels of pesticides found on your food after legal uses of pesticides that were below the legal limit. And for prescription drugs, it was described as higher doses delivered by mouth or other route, potentially daily. Now, the exposure to chemicals would be much higher from taking prescription drugs. I happen to take a few of those, and I've read the literature. And it's pretty scary sometimes. And you're taking a dose that's measurable, sometimes for many years at a time, or potentially for the rest of your life. But look at how the seesaw changes. If the benefit is low, then the risk is high. If the benefit is high, then the risk is low. And in both of these cases, they're ranking the risk lower for things that actually have a higher dose. I hope you find this as interesting as I do, because that was wild to me, and it helped me understand that maybe I need to also talk about the benefits of the risky thing in order to put it in the right context. Risks are less likely to be acceptable if the benefits are hidden from view, or if the benefits are not fairly distributed among those who bear the risks. Who benefits from this risky thing and who experiences the risk from the risky thing. If there's a mismatch there, that can be very difficult. But I have worked over time at getting better at describing the benefits of pesticide. With this slide, I'm intending to communicate that both agricultural and natural landscapes benefit from pesticides. When we control invasive species and remove them from the landscape, the native species can continue to thrive and feed those native populations of insects, amphibians, birds, fish, and everything that depends on them. I went to school with a lot of folks that ended up going into environmental restoration work, wetland management, those kind of jobs, and almost all of them are using herbicides in their work to maintain these landscapes in a way that doesn't get taken over by invasive plants. And we anticipate invasive species will increase with the onset of climate change. So it's something to be aware of. Now, I'm going to leave the concept of benefits for a moment and add another one. So we have the risk equation. We know that's relevant. We have to talk about toxicity and exposure. I'm making the case you also need to talk about benefits. But the next one is control. And that's because risk denial will increase with perceived control. If I'm in control of the thing, then it's less risky because who do I trust? If I'm in control of it, then I feel much more comfortable with it. So who's in control of the exposure, of the pesticide application, of determining how much risk people are going to take? Who's in control of it? And the person who is exposed, do they have action items in their own control? The way we use this at the center is we give people lots of ways to minimize exposure, ideas. So for example, if someone was having a liquid pesticide applied in their residential yard, then this came from a staff meeting where I just kind of asked the staff, what are some ways to minimize exposure in this scenario? And we kind of wrote them all down. Those are all steps that someone could take to reduce their exposure. They're not required. If you were to read that whole list to someone, they might get the sensation like, man, this stuff must be really toxic. And they might actually take it as alarming if you overdo it. So I'm not suggesting that you give them this many options, but do give them a couple options that would make sense in their scenario. So they have action items within their own control. I hope that makes sense. Action items in your control can make you feel like you can actually act on the system and you're not, it feels more fair that you can do something about it. So what I'd like to do to bring that together, I understand that risk decision-making has to be based on the toxicity and exposure because those are the components of risk. But I'm going to make the case today you should also consider benefit and control as important elements in risk perception and therefore important elements in your risk communication. Who benefits from the risk? What are the benefits from that risk? And control. Who's in control of it? What can the individual do to control their situation and their exposure? All right. Now I'm going to talk, that was my intent to cover the what to talk about with people when they ask about risk. Now I'm going to talk about the how to talk about it. I'm going to introduce this section with some more points from Dr. Paul Slovic, who came to visit OSU. Gosh, I can't believe it was 10 years ago now, but I'll call myself a fangirl. I've read just about everything he's published. It's just so interesting to me. It helped me really understand what was happening on the phones. First, we need to understand trust is critical and it's very hard to win and it's very easily lost. Risk and risk assessment are subjective and they are value laden. If you define risk one way, the best solution might be this. If you define risk another way, the best solution might be that. We should recognize as toxicologists that defining risk is an act of power. Let me show you. If we were to ask the question, is coal mining getting safer over time? If you define that as accidental deaths per million tons of coal, in the graph on the left, it looks like the accidental deaths are going down over time. And yes, mining is getting safer. But if instead you look at accidental deaths per 1,000 coal mine employees, it tells a completely different picture where things are relatively stable but trending slightly upward. Who decides? Who gets to make this decision about which measure is the most important and useful? What lobbyists are involved in influencing this kind of decision making? And both of those examples were counting fatalities. Counting fatalities is going to give equal weight to young and old, painful and painless deaths, voluntary and involuntary exposures, fair and unfair situations. Defining risk is an act of power. So when you very succinctly respond, the risk is low, or don't worry about it, it's safe. It can come across like, I'm in charge, trust me, your opinion doesn't matter. Be aware The even saying if something is low, moderate, or high in risk is taking on an act of power. You've made a decision to define it using certain terms that may or may not reflect that community's values. Now I'm going to share a piece with you that I learned from one of my public health interns. I've had several public health interns that helped teach me a lot about public health, and they were taught in school that the deficit model is a trap. This idea that the expert on top of the podium back there, that they're the ones with the knowledge, and everyone who's out here listening is lacking knowledge. And they put themselves above the audience. And take a stance where they might not be listening. If you picture this audience like they're lacking knowledge, why would you ask them a thing? You would just show up and tell them how it is and leave. That model leads to this. Here, have another fact sheet, have another video. They don't get it. I can't help it if people don't understand science. Raise your hand if you've heard someone say that in a staff meeting before, right? I can't help it if they don't understand science. Maybe it's that you don't understand what they need answered. Maybe it's that we don't speak in the way that they need to be spoken to. And maybe it's that we don't think they have anything to share, and that's insulting and inaccurate. Let me give you an example where the audience has something very relevant to share. There's a scenario where we're talking about the risk assessment of roadside weed killers. We use a lot of herbicides on roadsides to keep those areas safe for motorists. And one of the concerns that came up when speaking to tribal communities is, hey, did you know that we like to collect reeds, plants from ditches and ditch banks to make baskets? And did you know that we often make baskets using our mouths as a third hand? Oh, well, you're right. We did not include that kind of a risk exposure scenario in our risk assessment. Since then, they have started adding that to their considerations in the risk assessment, especially when there are aquatic plants nearby that could be used in basket making and more communication going on there. But it's just an example of the kind of community level information we need to listen for. There might be unique exposure scenarios. There might be unique polymorphisms that are prevalent in certain communities. We should be listening and asking. The truth is, we have knowledge, but we also have values and status that got baked into the risk assessment or our trust of the risk assessment. But then the community that we serve also has knowledge to share, values, and status. If we think of ourselves as equals, that we're here to have a conversation, and that maybe we're even here in servant leadership. If you work for a public entity, that can be appropriate. Take yourself down off the podium. I don't recommend podiums anymore. Instead, have a conversation. Now I'm going to share some things I've learned about gut feelings and those quick decisions like the lizard brain is responsible for. There's some literature around this idea of probability neglect. When your feelings about the outcome are really strong, then your feelings about the probability are really muted. It's almost like that risk-benefit teeter-totter. If my feelings about the outcome are strong, then my feeling about the probability is low. So here's an example from my own life. I'll tell you, when the lottery goes up to $1 billion, I'll buy a ticket. I'm smart. I have a master's degree. I know that the chance of winning the lottery is vanishingly low, and I will ignore that probability because my feelings about winning $1 billion are so strong. It works the same way if the feelings are negative. Another way of saying it, people are prone to probability neglect, especially when their emotions are intensely engaged. When probability neglect is at work, people's attention is focused on the bad outcome itself, and they are inattentive to the fact that it's unlikely to occur. Here's a study from toxicology that kind of lines that out. They ask people to rank the benefit, the risk of exposure to a thing with different doses. So for toxicologists, they knew that a low exposure was probably a low risk. And they put this way down here. High exposure is a higher risk. So you can see the slant here is extreme, where the number for the public, it's almost flat. Where they said, look, if it's a problematic chemical, then I am just as concerned about low exposures as I am about high exposures. For the public, if a large exposure is bad, a small exposure is also bad. And this is particularly true when it is a dreaded effect like cancer. Just the word cancer can elicit a lot of emotion in people because a lot of us have lost someone to cancer, and it becomes very personal and emotional, and your emotions get strongly engaged. And then all of a sudden, all your talk about low probability just goes right in one ear and out the other. This obviously happened to me on the phones a lot, and that's why I had to like dig in and figure this out. And now I understand it a little bit better. And I'm much less likely to talk about probabilities with a person who's experiencing strong emotions. Instead, I'm asking them what information they need, what would be helpful to you, instead of throwing out, well, there's a very low possibility that that actually caused the effects you're seeing. They're not going to hear it when the emotions are intensely engaged. You know how you can bring the level of emotion down in a conversation? By listening, empathizing, apologizing, and problem solving. Look how I wrap it up. Indeed. I'm going to go really fast through this next one because I know I'm running out of time. In this study, people with different worldviews were asked about their attitudes toward nanotechnology before and after being given information about nanotechnology. And when they say different worldviews, they kind of lumped people into different buckets using questions like this. They asked, how much do you agree or disagree with statements like this? And then they would ask them this next piece. Let me show you the data. Before they got the paragraph or whatever about nanotechnology, they were all kind of lumped together, ranking the benefits and risks right between 2.6 and 2.7 on a scale of 1 to 5. They're all basically the same, but then they all read the same information. One paragraph about the promises of nanotech, but also some of the potential risks. The individuals in the hierarchs decided after reading that paragraph, they thought the benefits were greater than the risks. But the egalitarians and the communitarians read that same paragraph and decided the risks were greater than the benefits. This helped me understand so much that it really does come down to worldview and the differences that might occur. So if you increase the perceived benefit or the perceived control over the situation, it can decrease the perceived risk. These are two outrage factors that were described by Dr. Slovic, University of Oregon Psychology, and he called these outrage factors and started publishing a lot on them. There are more. So control and benefit are on this slide, but also he's done studies to substantiate if something is voluntary, people perceive the risk lower than something that is imposed upon them. If something's natural, they perceive the risk is lower than something that is man-made. I'll let you kind of look at the rest of that list on your own and think about the systems that you work in. Are there some untrusted entities or unfamiliar compounds or things that affect children? You should be aware those things are increasing the perceived risk regardless of the actual probability of harm, because risk incorporates all of these concepts and ideas in together. I'm just going to blaze through the rest and show you as we finish up that benefit and control. Based on that, this is a proposed checklist. If I was going to take a picture of any slide in this presentation, it might be this one, because this is the checklist we use at the center and I still use today when discussing a risk-based question. Listen, ask questions, and clarify. Frame it as risk rather than safety. Provide information about the hazard or the toxicity if it is a toxin. You could use this same approach for ladder safety or whatever. That's what I mean by the hazard. Provide information about the exposure and perhaps have some back and forth about the exposure scenario. Discuss the benefits of the activity or the thing. Now, if someone's already been exposed and they're experiencing negative effects, don't talk about the benefits of pesticides. But if someone's making a proactive decision whether or not to go to the school board meeting and demand they stop using herbicides on the school lawn, you might let them know. One of the reasons they do that is because flowers in the lawn can attract bees, and some of the kids in the school are allergic to bees. So just mention what the benefit of the spray might be, or the exposure. Action items in the person's control, and where to get more information. That last piece is important because it makes you more trusted. If you just say, take my information, you don't need any more, just trust me, it comes across as untrustworthy. But if you give people information and say, if you would like to double check that by going to your local library or calling, I don't know, the National Pesticide Information Center, that's one way to make you a more trustworthy entity, because you're saying, don't just listen to me, gather all the information and make up your own decision. You're also treating them with respect when you do that. If you were really interested in this presentation and you're interested in communication in general, I encourage you to check out the Debunking Handbook. It was republished in 2020 by the Union of Concerned Scientists, and this is one of the nuggets you'll get from that Debunking Handbook, the overkill backfire effect. If you try to counter a myth with too much information, people just walk away remembering the myth. We have to get good at counteracting myths with factual information using fewer words. Using fewer words. And it's on us. I don't want to hear another scientist come back and say, it's not my fault they don't understand. Yes, it is your fault they don't understand. We need to get better at communicating. Or what are we even doing here? The last one I'm going to leave with you is this study, finding the sweet spot between communicating threat and danger or reward and benefit. So the example I'll give you here is if you wanted to make a poster campaign about quitting smoking, and you had to choose your messages. You could choose a threat and danger message like smoking will kill you, or a reward and benefit message like if you quit smoking, you will live longer. Now, let me ask you to write down, if you have a pen now, guess on a scale of 0 to 100, there is a number. Where do you think the most effective number is for helping people remember this information long term? Recognizing if you're in a threat and danger space, norepinephrine is prevalent, you're on alert. If you're in a reward and benefit state, you're more relaxed, more dopamine mediated. What numbers? Write down your number. Is it a 40? Is it a 80? Is it just a straight 50? I'm going to show the real number in 5, 4, 3, 2. It's a 60. So it should at least lean toward the reward and benefit. If you're going to talk about the threats and danger, also talk about the reward and benefit of avoiding the exposure or keeping it positive, because once you're in that dopamine space where you're relaxed, you're much more capable of committing things to long-term memory. So just in summary, I'll make some suggestions. You don't have to read the white bullets necessarily because we already went over them, but the suggestions are in yellow at the bottom. Listen first, paraphrase the concern, get agreement on the question. Like, are we talking about the same thing? Are we using the same terms? Do I understand your question properly? Address those emotions first, because the people may consider probability in their risk perception if the level of emotion, the intensity of emotion comes down. A couple more suggestions. Don't be silent about the benefits when discussing risk. Don't define risk for people. They may feel dominated. And I encourage you to discuss risk rather than safety and ways to reduce it. Empower people. In closing, one more chance to take a picture of the checklist if you would like, but of course you don't have to. And remember, there is such a thing as the National Pesticide Information Center, and I hope you use us, rely on us. You're welcome to even copy and paste from our website. It's all been developed with public funds. And with that, I wanted to make sure and give you my email address. It's at the bottom of this slide. If you'd like to reach out, you're welcome to. If there's a risk communication challenge that you're struggling with, or a concept you think we need to add, that's also reasonable too. I look forward to your questions.
Fantastic. Well, thank you so much, Casey. That was really a phenomenal presentation, and I appreciate the emphasis you put on real world examples and just a great example of the complexity of these issues. So thank you so much for sharing. We got a lot of really interesting questions from the audience and a lot of interest, particularly around cancer. And I think, I appreciate the emphasis you put on how emotionally laden certain terms can be. But I think from a technical perspective, there's also some differences in the way we think about risks related to cancer. And so one of our audience questions was related to that. They asked, can you talk about the one-hit effects of exposure to cancer-causing agents? How do you reconcile risk perception when it comes to something that could cause cancer at a very low exposure level?
That's a great question. So one of the phrases I've used over time is that it's kind of like crossing a busy street. Every time you cross the busy street, you run a risk of potentially getting hit by a car. And it's like that when you get exposed to carcinogens. Um, you might have a mutagenicity impact, you might have a genotoxic impact, you might not. And it takes at least a dozen different kinds of mutations to happen before cancer can develop successfully. So some of those hits might come from your diet, they might come from your occupation, they might come from your personal care products or medications. Some of them might come from the pesticide exposure that you're discussing. But if you get cancer at some point in life and you ask your doctor, what caused my cancer? They wouldn't be able to tell you in most cases because it could have been these multiple hits coming over time. So I just explaining that in plain English is often new to people. And what it leaves people thinking, the risk averse people are like, okay, so I just need to avoid all exposures and then I'll cross the street less. Yes. But the people who are more risk tolerant say, well, all right, um, I guess I'll minimize or take special precautions to try to make sure it's not getting into my body or something, but they'll hear it different ways. Is that a helpful analogy?
Absolutely, yeah, absolutely. I think that is. And there was a lot of questions related specifically to glyphosate and non-Hodgkin's lymphoma. And I've noticed in my teaching when I talk about pesticide risk, this is something that a lot of folks are interested and engaged with, and I'm sure it comes up in your work with NPIC. So some of
It
it, there
sure
was
does.
a variety of different questions, but one of them said, has there been any progress on linking glyphosate exposure to the occurrence of non-Hodgkin's lymphoma? And I might kind of add to that a question about how we perceive different lines of evidence, thinking about epidemiological lines of evidence where we look at human populations and assess disease prevalence versus toxicological experimental lines of evidence with animal models, and maybe how you think about communicating those different lines of evidence to the public.
Certainly. So I've had that question a lot, so many times. In fact, I have a whole presentation on risk and glyphosate, and the National Park Service asked me to give that presentation because they get questions about glyphosate being used in the parks a lot as well. And I put that presentation on YouTube. So those of you who are super interested, I'll put a link right there to the YouTube presentation that includes part of the risk talk that you just heard, but it also goes into the toxicology of glyphosate. My approach with risk communication is to lay out the data, show them like the animal data is more compelling than the epidemiological data. The odds ratios trend positive, but there's also some conflicting evidence with the biggest epidemiological study to date. The Ag Health study is not finding increased risk of non-Hodgkin's lymphoma from exposure to glyphosate. And it's the only study that can actually determine levels of exposure that I'm aware of where they have like quartiles, low exposure, all the way up to the highest. And there is not even a trend, a positive trend on non-Hodgkin's lymphoma in that graph. So what other co-exposures might there be? So my approach would be to tell them, lay it out, let them look at the data for themselves and make up their own minds. And since I've given that presentation at least 24 times in my life, and I've asked people, like, so what do you think now that you've seen the data? Do you think glyphosate is a probable, possible, or unlikely carcinogen? It's kind of all over the place. Reasonable people can disagree without it being something sinister, like the EPA is in bed with Monsanto or whatever. Like reasonable people can disagree about this data, and you too can make up your own mind, especially when it comes to choosing something with lower risk. If you don't want to have more glyphosate exposure, eating organic is a great way to reduce that potential because you can't use glyphosate in organic production, and of course using different methods around your own home and things like that. So empower people, answer their questions, show them the data, let them decide.
Well, I think that's a great answer. I really, I can see all the strategies that we just talked about in the presentation coming through in your answer. So I think that's great to see. Maybe we have time for just one more question. We do need to end right at noon here, but I wanted to ask one question that came through was, where can we find information from produce and other manufacturing or food industry providers on their application techniques and pesticide types? So I know product labels say what we can do, but where can we get information about what's actually being done in practice?
That's a really good question. What you're asking for is pesticide use data, and it's the white whale. We're all looking for it. No one has it. California does. California has pesticide use reporting. Oregon passed a law for pesticide use reporting, but it was unfunded immediately, so we don't have that data. But I'll tell you one place that you might find useful information. Um, the Western IPM Center funds projects called crop profiles and IPM strategic plans. So for each cropping type, like apples or grass seed, they'll publish a report that says, here's all the pests we struggle with and what kind of things we do to manage it and what time of year. So when I get a call from someone who said, I just moved in next door to a blueberry field and it looks like they're having a real busy season in April, what are they doing? You can probably go to that pest management strategic plan and see what they're doing in April.
Fantastic. Well, thank you so much, Casey. We really appreciate your presentation today, and thank you so much.
You're welcome. Thank you so much. Take care.
Bye-bye.
Bye.